Joint pain isn't just an everyday problem for many older people who have arthritis or gout. Well, it has been estimated that about 73% of arthritis patients are older than 55 years, and shockingly, 60% of them are women. But you might be surprised to know that osteoarthritis may start as early as in your 20s, and as you enter your 30s, you may start losing bone density, muscle mass, and joint integrity. And nowadays, more and more people in their 30s are reporting that cracking sound coming from their knees, their lower back, and their neck and shoulder joints as they move. So today, let's learn exactly what causes joint pain and inflammation, some of the best foods for joint pain relief, and how should you eat them, keeping in view any existing health conditions you might have. First, let's have a brief look at what causes joint pain and what makes it worse. Well, the cause depends on the type of joint condition you might have. Understanding these causes and conditions is crucial if you want the natural remedies for joint pain relief to be effective. For example, osteoarthritis is arguably the most common joint condition. It happens when cartilage, which makes the joints almost frictionless and easier for the bones to slide over each other, deteriorates. Aging, obesity, joint injuries, and repeated stress on the joints if you're an athlete, a sports person, or a physically active person can further contribute to this condition. Another very common condition is rheumatoid arthritis, which is an autoimmune condition, meaning it happens when your own immune system starts attacking your own healthy cells and tissues. It's not known exactly what triggers this reaction, but research shows that genetics, hormonal fluctuations, and some environmental factors, and sometimes even stress, might play a role. Another one is gout. It commonly happens in people with a family history of gout, but people who are older, obese, and ones who have chronic conditions like heart disease, diabetes, kidney disease, and some others are also likely to develop this condition. Diet and lifestyle choices play a very important role here. You might be at a higher risk of developing gout than others if you smoke, drink too much, or eat a lot of processed foods, including processed meats and processed snacks. By the way, extra sugary foods and drinks, especially the ones that contain fructose, stand at the top of the list of worst foods that trigger gout flare-ups. And for the record, table sugar is about 50% glucose and 50% fructose. So foods and drinks that contain added sugar still fall in the category of things that can cause or trigger gout flare-ups. Remember that eating a lot of protein-rich foods, or those that increase uric acid levels in the body, isn't a direct cause of gout. Instead, it's basically the body's inability to process or handle the uric acid that's being produced when you eat certain foods. For example, if you have kidney disease, your body might not be able to remove uric acid effectively, so that extra uric acid might turn into crystals and deposit inside joints, causing gout. Similarly, dehydration and things that cause dehydration, like alcohol, coffee, and diuretics too, can contribute to gout flare-ups. Besides that, high blood pressure too can affect kidney function and affect kidneys' ability to remove uric acid effectively. While high blood sugar and diabetes can directly damage the tiny filtering units inside the kidneys, increasing the risk of developing gout and other conditions in general. Keeping in view all these causes and risk factors for joint pain, let's take a look at some of the best natural foods and supplements to repair your joints and relieve joint pain. Number 1. Fish. Fish, including salmon, trout, sardines, and tuna, are among the best sources of omega-3s, especially EPA and DHA. And these two omega-3s are the primary reason why the American Heart Association suggests heart patients eat fish regularly, about 2 to 3 servings per week. First of all, these omega-3s have anti-inflammatory properties, meaning they help lower inflammation in the body, including the one that could be contributing to pain and swelling in your joints, whether you have osteoarthritis or rheumatoid arthritis. For people with gout, however, salmon, tuna, and tilapia might be good options since they're lower in purines compared to others. Moreover, if you can't eat fish regularly, or you have gout, or you are on a diet that's restricting protein intake, There's another good option: fish oil supplements. There's no specific recommended dosage for fish oil supplements, but the American Heart Association recommends taking 1 gram of EPA and DHA combined. A typical 1,000 milligram fish oil supplement provides about 300 milligrams of EPA and DHA combined. Read the manufacturer labels to see how much of these compounds are there in the fish supplement you're considering buying, and talk to your healthcare expert about the most appropriate dosage suitable to your needs. Number 2. Water. You might be surprised to see something as simple as water on our list, but water is probably the best lubricant you can give to your joints. In fact, synovial fluid that essentially facilitates joint movement is about 70 to 80% water. And according to the Arthritis Foundation, when you're dehydrated, your body enters a kind of survival mode. While prioritizing vital tasks, it starts drawing water from other parts of the body, like joints and muscles. This effect can increase pain and inflammation in your joints. Staying hydrated is also crucial for the kidneys to flush out toxins and inflammation-causing chemicals from the body. So, always listen to your thirst signals and keep yourself well hydrated. Number 3. Nuts and seeds. Almonds, walnuts, flax seeds, chia seeds, sunflower seeds, and other nuts and seeds are good sources of healthy fats, plant-based protein, and minerals like calcium, magnesium, and phosphorus. Healthy fats in them, more specifically, an omega-3 fatty acid called ALA, help lower inflammation in your joints, while minerals like calcium, magnesium, and phosphorus are essential for bone and cartilage health in general. Another pretty impressive thing about nuts and seeds is that they help you lose weight. They are rich in both fiber and protein, make you feel full quickly, suppress hunger, and prevent you from munching on high-carb snacks. This can be very helpful if you want to lose weight, which, by the way, adds more weight to your joints and makes joint pain and inflammation even worse. That said, it's equally important to avoid refined carbs and added sugars. These things aren't just calorie-dense and make you gain weight quickly, but they also tend to make you feel hungry much more rapidly than fats or proteins. Plus, these things also tend to promote inflammation in the body, which you obviously don't want if you have joint pain. Number 4. Turmeric. With its bioactive compound curcumin, turmeric has been shown to be particularly effective against joint pain and inflammation. In fact, studies show that turmeric might be just as effective as ibuprofen, a well-known non-steroidal anti-inflammatory drug. All you have to do is just add a pinch of turmeric powder to your dishes, salads, or smoothies. You can also take turmeric or curcumin supplements as per the advice of your healthcare expert. For osteoarthritis patients, 500 milligrams to 1,500 milligrams of turmeric can be taken safely for up to 3 months. Talk to your healthcare expert for the most appropriate dosage, especially if you already have any chronic health conditions. This is important because turmeric can interact with certain medications, such as anticoagulants like warfarin, blood thinners like aspirin, metformin for blood sugar management, and others for blood pressure, liver disease, and kidney disease. Number 5. Berries. Berries are generally a good source of vitamin C and many powerful antioxidants. Among berries, blueberries are among the best anti-aging fruits. That anti-aging effect doesn't just apply to your skin, but also to your blood vessels and all of your vital organs, including the brain, heart, eyes, liver, kidneys, and muscles and joints, of course. Blueberries are also a good source of vitamin C, which not only helps in that anti-aging effect, but our body also needs it to make collagen, which makes up 30% of the total protein in the body, including the kind that makes up cartilage, bones, tendons, and ligaments. Consider eating a 1-cup serving of blueberries every day, preferably in the breakfast. Number 6. Leafy greens. Kale, broccoli, bok choy, spinach, and collard greens are particularly rich in many powerful antioxidants, especially vitamin A, vitamin C, quercetin, and several others. These antioxidants can help relieve joint pain and inflammation, and also have anti-aging effects, so eating them regularly might make you feel younger from both inside and outside. Leafy greens are generally safe for people with heart disease and diabetes, in quantities that are typically used to make salads. But if you have chronic kidney disease or a history of kidney stones, watch out for their potassium and oxalate content. Butterhead lettuce, romaine lettuce, arugula, cabbage, and kale are relatively lower in both oxalates and potassium than others. But it's best to talk to your dietitian or healthcare expert if you have kidney disease or other chronic conditions and want to eat leafy greens safely. Check out these videos too.